In tonight's WGN Investigates, it may be time to check your health insurance coverage. Negotiations between two healthcare giants are going nowhere, potentially leaving thousands of patients in the dark.
Investigative reporter Lourdes Duarte takes a look at both sides of a negotiating line that could affect your bottom line.
Both sides say they want to reach a deal, but by the end of this week, you may have to change your hospital provider if United Healthcare and Loyola don't agree on a contract. One woman sat down with us to explain why the chronically ill may feel the biggest headache.
Hi, who's Marie? Right there. Hi, Marie.
5 years ago, our cameras captured the meeting between Fanny Vlahos and the family of the man who helped keep her alive.
I don't know if I just, I'm sorry and thank you.
Born with cystic fibrosis, she received a double lung transplant. Her donor, Marcus Morgan, had been shot and killed during a violent Memorial Day weekend.
Because he was the glue. He was the glue.
Back then, her story brought attention to organ donation.
Oh, Stella. Dog? Is that why she's...
While she's doing well today, she wants to bring attention to a different issue after receiving a letter that could impact her everyday life.
The letter explained that negotiations between United Healthcare and Loyola have broken down. And so as of June 15th, Loyola will no longer be in network.
United Healthcare is her insurance provider. Loyola is her hospital. The two sides have been unable to agree on reimbursement rates long term. No deal is a big deal for people like Fanny.
To say I've been a frequent flyer of Loyola is an understatement. And so all my specialists, everybody from my lung transplant to hepatology, hematology, dermatology, everybody, all my specialists are at Loyola.
And she's one of potentially thousands of patients right now scrambling to figure out what's next. It's less of an issue for someone with few medical needs, but it's a pressing issue for the chronically ill like Fanny.
For example, I treat cancer patients. And cancer patients I've treated, I still see some for 20 years. There's no way someone can be picked up with another provider, another physician, and have that same level of care and that same level of comfort.
Dr. William Small at Loyola Medical has been watching the negotiations play out while trying to ease worried patients about the mid-June deadline.
I think it will cause a disruption for a lot of patients, and it's caused a lot of anxiety in our patients. They're very nervous about what will happen in the future.
While both sides say they want to reach a deal, here's where things stand. Loyola argues United Healthcare hasn't provided a rate increase in more than 2 years. WGN Investigates reached out to United. They say Loyola's parent company, Trinity, is asking for a 20% increase and, quote, leveraging local communities by threatening to create widespread disruption in healthcare in order to drive up costs to benefit its national organization's bottom line. The back and forth has patients caught in the middle.
So I'm stuck with either we pay the out-of-network costs with Loyola or I switch programs. And those aren't decisions that patients, chronically ill patients, should have to make.
She keeps fighting to address it, reaching out to legislators with ideas.
To make it unlawful for an insurance company to unilaterally declare an entire institution or even certain providers out of network in the middle of the year for chronically ill patients.
These days, her story sheds some light on the brewing battles between hospitals and insurance providers over dollars and cents.
I don't think this is by any means unique to Loyola Medicine. I think this is going on throughout healthcare.
The American Hospital Association agrees. It told WGN Investigates that healthcare providers sometimes have a tough time securing authorization for services or payments. And, quote, some of these issues get to a boiling point where decisions are made to not participate in networks anymore.
This is my INR testing.
The battle has left people like Fanny forced to make sense of an already complicated system.
I just felt an obligation to speak up. What about those who don't have the option to go to another center and those patients that wouldn't be able to afford the out-of-network cost?
And current Loyola patients are able to apply for what's known as continuity of care to remain at Loyola with the same in-network fees. In the last week, Fanny Vlahos was given a 90-day extension under that continuity of care application. She's not sure what will happen after that, though. Again, changes will go into effect on June 15th. I'm Lourdes Duarte, WGN Investigates.